Okay. Well, very good. We're recording. Hi, Dr. Garcia. How are you today?
I'm doing well, Judd. Good to see you.
Good to see you too. I'm Judd Mellinger Block. I'm the director of the Pennsylvania Primary Care Career Center, and I'm here today with Dr. Luis Garcia from Family First Health in York, Pennsylvania. Dr. Garcia is a family physician there. And Dr. Garcia, why don't you introduce yourself and tell us uh, about yourself a little bit?
Oh, sure. I went to medical school at Temple in Philadelphia, and I did my residency at York Hospital. And I liked this area so much that I decided to stay and end up working here. So I've been working at Family First Health now for 6 years. Right after residency, I joined the group, and I've been loving it ever since.
That's great.
So, yeah.
Great. And I believe we're doing this at 8:30 at night. You just tucked a couple little ones into bed. Help do that.
Yeah, in fact, I just hear one of them. She snuck out of bed and is talking to my wife in the back room over there.
All right.
So we'll see. But yes, I have three girls. I have three beautiful daughters now. So
Oh, nice.
very busy, but very happy.
Yeah, yeah. That's a blessing. Very nice. So tell us, when did you first feel drawn to a career maybe a career in medicine to start with, but then also primary care, and why were you drawn that way?
Yeah, those are good questions. So my journey into medicine has always taken the form or has always been influenced by mission work. So when I was in high school, I had a very unique opportunity. I went to a Catholic Jesuit school in Baltimore, and I had a unique opportunity to do a 2-week mission trip to the Dominican Republic. And what was unique about this trip was that it wasn't just doing some type of like service, but it was very active learning. And so we had time literally driving through slums, walking through villages that were built on top of, uh, trash, big piles of trash. Yeah.
Right.
And wastelands, and talking to the people, meeting the people, but also meeting with some of the intellectuals in the area, sociologists, other people, and getting a better understanding of poverty, of its causes, of some of the root reasons why poverty exists, and then going out into the field and the communities and trying to do something about it. But primarily, the reason was for us to learn about poverty, and then using that knowledge and experience to empower us to try and make a change. And so one of the things that I realized on that trip was that when people are poor, no running water, no electricity, that type of thing, many of them, they live very simple lives, and they're for the most part happy. But when it comes to access to medical care, or if they have something medical that comes up that impacts their life, that can be extremely detrimental. And that's where I saw a huge barrier between the have and the have-nots, was in that aspect of medical care. So somebody that suffers an injury, we stayed in a community that worked in a coffee harvesting plantation, and one of the members had injured his back, and then he couldn't work, and so he couldn't provide for his family, and that was it. I mean, and so the community chipped in and helped out and helped feed his family. But with just some simple ibuprofen, he was back on his feet, and was just very grateful for our help. And so that really stood out to me as kind of like, wait a minute, I can help out here. I can sort of make a difference here. Well, fast forward to medical school, and I had already gone on some medical mission trips through my college, through Franciscan University at that time, and realized that doing medical mission trips was good in foreign countries and was helpful, but there was such a great need in our own communities here in the United States, and there's still so many undocumented persons, people without insurance, people underinsured, and people just living in abject poverty that could use our help. And that's really where I felt called and where I felt like my work was meant to be, in particular because I speak Spanish. And so I felt that, my parents gave me that gift of speaking Spanish, and I almost felt this responsibility, this obligation that I had to do something with that gift and give back to the community. And so that's kind of how I found sort of a niche, if you will, that I knew I wanted to serve this population. How I came to family medicine, though, was during one of those medical mission trips. It was in Ecuador, and I was in medical school trying to figure out what I wanted to do. I thought I wanted to do OB-GYN, but I wasn't really entirely sure. And I was there with a family doctor, and I was his interpreter at the time. And we got a call. We were kind of in our little community base. We got a call that a woman was in labor and she needed help, and that she was in distress. And so he had been spending his whole day, looking in ears and kind of doing the basics. But then he just kind of packed his bags and went off and, to help deliver a baby. And I followed along with him. And the fact that like he could just sort of shift and go from one place to another and just sort of knew what to do and was comfortable in all these different types of
Right.
scenarios was really neat to me. So,
Yeah.
I had a wise resident share with me once, like, for yourself, think of what a doctor is, what a good doctor is, and go do that. So that's what I did. So I found family medicine kind of through that example, through some of those kind of words of encouragement, and really just finding my place in this is kind of where I can serve the community. So
That's great.
yeah,
That's great.
yeah,
Yeah. It's amazing the impact that really witnessing poverty and really learning about what people living in poverty, what they go through, as opposed to the assumptions that we make, those of us in the middle class and upward make about people in poverty. We don't understand it. Would you agree with that?
absolutely, absolutely. I mean, there's no way, unless if you have spent time in your life living off of, welfare checks and
Mhm.
living off of food stamps, then you really have no clue. You have no idea what it's like to live that way. And I haven't lived that way. I know
Right.
only from the experience of my patients and secondhand. But I've, praise God, I haven't had to go through that. But you're right. It's something that's hard for us to really fully comprehend. Um, yeah.
Yep. Thanks. So you're in a community health center. Tell us a little bit about Family First and what it's like there, the organization and kind of the way it's set up, and then we can talk maybe about why a federally qualified health center, why a community health center.
Sure. Yeah. Family First Health has been in the York and South Central Pennsylvania area for 50 years.
Wow.
So
Wow.
we're coming up on celebrating our 50th anniversary this year, of course, in 2020. But we the FQHCs and our community health center in particular sprung out of a response to the York race riots. So these
Ah,
were riots that took place in York. You can Google all about them, but they were during the era of the civil rights movement, where a lot of these type of protests were going on. The National Guard had to get pulled into our city. It was a dark time for our community, but some community leaders later on saw that one of those disconnects and disparities was related to access to healthcare. And so they formed what was then the York, I believe it was the York Community Health Foundation, and
uh-huh.
later
Okay.
on that turned into Family First Health.
Right.
And so we've been serving the community now in York during this time. We've got 7 locations now, 2 in York City, 1 in Gettysburg, 1 in Hanover, 1 in Lewisberry, Columbia, and our newest one is up in Lebanon.
Right.
So we've been able to serve all those different communities, and each one of those communities is unique, is different.
Mhm.
My population in York City, in York City, we've got about a quarter to a third population is Spanish speaking in the
Mhm.
city. So that's primarily what I see in my office, in my practice. But you go over to Columbia, it's going to be very different. You go up
Right.
to Lewisberry, and you're dealing with a little bit more of a rural
Mhm.
population there.
Mhm.
Um, Obviously, in York City is going to be more urban, and then in Gettysburg and Hanover, you have a little bit of a mix there as well.
Right.
So, we offer all kinds of services: dental, HIV
Right.
care. Uh, we have care for helping out pregnant women. We don't do OB in our practice, but we do have basically like what's called the nurse family partnership and community health
Yeah.
workers that help women during their pregnancy, and then after the baby is born, they can help them out in many ways there. So we're able to
Awesome.
offer a lot to the community.
Right. Right.
It's been an honor to be part of our organization when I see the grand scheme of all the ways
Mhm.
that they work. And
Right.
I'm just a little guy in my little corner seeing patients, in two or three different
Right.
rooms. But it's cool when you see that you're part of this bigger endeavor that's really making an impact, really making a difference in people's
Right.
lives.
That's great.
Yeah.
Talk a little bit about what I know that, not every community health center offers this, but I know that Family First offers both. In addition to primary medical care, they offer dental and behavioral health care also. Talk about a little bit about, what it's like to work in an environment where you have those resources around you.
Oh, it's great, Judd. I mean, today I did work from home doing telehealth visits. And one of the patients that I was seeing, I knew needed to talk to a counselor. We were talking about anxiety. And so I was able, with my EHR, I just sent a message to one of my behavioral health counselors. I said, hey, can you give this person a call? I'm going to be finishing up with them in a few minutes. And she was like, sure. And so right afterwards, she called him, had a conversation with him, messaged me back the feedback, did her own note and everything. And so the ability to quickly and directly connect people with counseling is so critical. I mean, it's
Right.
so critical.
Right.
So, we're talking about a population that just, many of them just live in chronic stress, and a
Right.
level of stress that we, like we were talking about earlier, that we don't fully comprehend, we don't fully understand. Like, unless if you're living on a street where every night you're hearing gunshots and you're worried about your life and you're worried about putting food on the table and you're worried about, your roof leaking because your landlord isn't doing his responsibility of,
Right.
like, these are things that my patients tell me all the time. And in many ways I feel helpless.
Right.
We do also have what we call guided care coordinators. So these are kind of like case managers, social workers,
Mhm.
like
Right.
those type of people that can help people in those type of situations get connected to community resources, can help guide the patients to putting in a complaint to the city for the landlord, like that sort of thing. So
Right.
we do have that ability as well. And being able to have all of these other people that are helping me do my work has just been incredible. I mean, I don't know if you were gonna go here or not, but like, here we're starting to talk about the social determinants of health, right?
Yeah.
And that's been one of the humbling things about my work, is realizing that, like, the work that I do, making diagnoses, prescribing medicines, like, those are all good, but that's actually a small portion of a person's overall health.
Mhm.
And some of the research shows that up to 80% of a patient's health has to do with their social determinants.
Right.
And
Right.
so we're well positioned in our organization where we can start tackling some of these social determinants with the behavioral health component, with some of the other social aspects, access to food, access to stable housing, access to stable transportation, these type of things that really affect someone's health. We're able to start moving those and impacting those in a way that I can see the results in the person's health. I can see their hemoglobin A1Cs start improving. I can see their blood pressure start improving because it's not just because I'm prescribing a medicine, right? It's because I'm prescribing a medicine, but now they have the ability to get from their home to the pharmacy to go pick it up. You know what I mean?
Right.
So,
Yeah.
um, so that, I mean, that's part of the beauty of working in an FQHC, working in the type of organization that that I'm working in, is that I'm not alone. I mean, I have a
Yeah.
whole team working alongside me. Um, uh, that are my extensions.
Hmm.
My they are my ears, my eyes. In those moments when beyond those 15 minutes or 20 minutes that I have with the patient in the room.
Right. Right. That's great. That's great. Yeah, it really is. It's holistic care. I mean, it truly. I tell people when I talk to them in groups that this is the truest form of primary care that I know of.
Yeah,
This is primary with a capital P.
yeah.
Um, I know we had talked earlier. There's we talked. Is there a patient story that maybe you would have that would typify that? And you said you had one to share.
Yeah, I mean, one patient comes to mind. We mentioned earlier a little bit about how some of the patients are undocumented, and so I remember I had this one patient come in. This was right after the holidays earlier this year, so this was about January of this year, and he came in, and we kind of greeted each other, normal type of greeting, and I was a little disappointed in him because his hemoglobin A1C had gone up. He had previously had his diabetes really well controlled. It was always around 7, and it had jumped up to over 9. I was like, what's going on? This guy,
Yeah.
very typical. I thought, like, okay, well, he's probably celebrating the holidays and not really taking care of himself, and maybe not taking his medicines. And so, I glanced at his medication list, and I noticed that he was just taking metformin and glipizide, two old medicines, two generic medicines, nothing newer. And so
Right.
that led me to remember, like, oh, wait a minute, I'm limited with the medications I can use because he has no insurance, right? He's self-pay. So that means I can't use some of the newer brand names that Medicaid covers a lot of those, but someone without insurance, I mean, those are out of reach.
Right.
So so we started talking, and I said, like, okay, hey, I saw that your diabetes got worse. Help me understand what happened. And he shared, well, the holidays can be very lonely, especially with my not being with my family. So,
Mm.
oh, where's your family? Oh, they're, down in Mexico. Oh, okay. When was the last time you saw your family? And he just kind of paused and he said, 13 years. And I thought, oh my gosh, like, this poor man has been alone up here in the States for 13 years. He's got two kids in Mexico that he barely knows, and a wife that they are able to FaceTime and everything. Um, but I couldn't imagine what that was like, and
Right.
here he is, um, basically working as a line cook,
Mhm.
and cleaning dishes, in the back of a restaurant, of a
Right.
diner, um, trying to make enough money that he can send home to his family, with only hopes and prayers that he could see them again one day.
Right.
Um,
Right.
and so that, uh, not every situation is going to be that dire, but many of the patients that we see are in very similar situations where they come from, they have, everybody has hardships, and especially in our populations, people have hardships. And when you come to understand those hardships, you come to understand the person. And really, that's what this is all about, right? I'm not here to just treat diseases. I'm here to treat people, to help people.
Mhm.
um, and and health, it's not just a number, right? I mean, we oftentimes we just focus on the number of the blood pressure, of the A1C, all those type of things. But health has a deeper meaning. It has a deeper, more profound meaning of, um, bringing kind of our spirits, our souls, our bodies into kind of a unity, into a harmony, into uh, a greater sense of being and purpose. And that's kind of my goal, is to kind of help patients try and find that meaning and that purpose, beyond their health, beyond the numbers. So when you get to that point with patients, when you get to that level with patients, and that takes time, right?
Sure.
That takes years of meeting patients, getting to know them. That's when, you really, like, there's nothing like that. I mean, to have that enriched relationship, that fulfillment that you can have with a patient, that beats, making a remarkable diagnosis any day.
Right.
So, and I certainly have plenty of those. I mean, I had a patient today that she was having numbness and tingling all over her body, and I did this crazy workup and found out that she was deficient in thiamine and vitamin B1. Who would have thought? And that's something that you see every day. So, like, we find that's been one of the exciting things, is that we find
Sure.
interesting things like that all the time. And that's fun, like helping people out, thinking outside the box, but it's nothing like developing that solid relationship with people.
That's excellent. That's excellent. Well, I think on that note, that's a pretty good place to end. I want to say thank you so much for spending this time with us, and great work. And it's great to have you in the community of community health centers.
Hey, Jed, thanks for all you do as well. So keep up the good work on your end.
Thank you. Thank you.
All right. Take care.
All
Bye.
right. Thanks. Take care.